Good evening, you're watching To The Point. I'm Preeti Chaudhary. The question we asked today is, will we ever really know the true extent of India's COVID tragedy? Why we say that? Well, viewers, what we've done is, India today has got down to some serious number crunching, where we've looked at data very closely from civil registration, hospital, crematoriums of those dead in the last 6 months. We took that data and then compared it with those dead in 6 months' time during the same time frame, let's say from January to June, in the last 3 years. What we saw in certain states was a spike of 1 lakh dead, more than what it was in the earlier 3 years. What does that actually mean? Because a lot of them would have died of comorbidities, nothing to do with COVID. But the fact is, which needs to be looked at, that there was a spike of many thousands in that same period than it has ever been in any other year in the past. Take a look at this report. The deaths that haunted India and the world outside. The number of dead, the COVID death toll. Will we ever know? Policymakers back home have repeatedly denied underreporting of COVID-19 fatalities.
वह रिपोर्ट टोटली बेसलेस है, एब्सोल्युटली फॉल्स है, क्योंकि रिपोर्ट किसी एविडेंस से ना तो सपोर्टेड है ना बैक्ड है कि इन टर्म्स ऑफ कि क्या बेसिस पर कैलकुलेशन की गई है। आप सबकी नॉलेज में है, हमारे देश में एक एग्जिस्टिंग रोबस्ट सिस्टम है फॉर रजिस्ट्रेशन एंड रिपोर्टिंग ऑफ डेथ्स का।
India today scoured through civil registration, hospitals and other data sources across several states.
Well, we studied this widely scattered data that has got to do with toll during 2021, the pandemic here, and also studied the data as far as deaths before the pandemic is concerned. We then tallied that data with the death toll associated with the pandemic officially declared by the government as COVID-19 deaths.
We then correlated the numbers with the toll officially attributed to COVID-19. Sample these numbers from Karnataka. In its civil registration system, Karnataka recorded more than 330,000 deaths from all causes till June 19th this year. 95,000 more than the 235,000 deaths recorded in 2019. And 86,000 more than the 244,000 deaths recorded in 2018 during the same 6-month period. Karnataka officially attributing 21,667 fatalities to COVID-19 so far this year. The state government, however, rules out any glaring discrepancy.
We have nothing to hide or fudge because that is not our motive. There could be some technical error, but I'll find out about it. It can't be such large numbers.
In neighboring Tamil Nadu, the state recorded a total of 318,000 deaths till May this year. 68,000 more than the 250,000 in 2019 and 82,000 more than the 236,000 in 2018 during the same corresponding period. Tamil Nadu's official tally, however, shows 12,097 deaths linked to COVID-19 from January to May this year.
இப்போ ஒரு 5 மாவட்டங்கள்ங்கிற மாதிரி ஷெட்யூல் பண்ணி வரோம். நாங்கள் போகிற எல்லா மாவட்டத்திலையும் நடத்துகிற கூட்டங்களில் ரிவ்யூ பண்ணும்போது கலெக்டர்ஸுக்கு சொல்கிறதே ஒரு சாவை கூட மறைக்கக்கூடாது. சாவு மறைக்கிறதுல எந்த பிரயோஜனமும் இல்லை, சாவு மறைக்கவும் முடியாது.
Crematoriums in the national capital overflowed in April and May this year. The Delhi government's health bulletin placed the COVID toll at 13,200 and one in these 2 months. But crematoriums showed 19,715 deaths from the pandemic. This as the city's 3 municipal corporations issued a total of 34,750 death certificates in April and May, up from 5,475 issued in the corresponding period last year.
दिल्ली के अंदर जितनी भी मौत होती है वो डेथ रजिस्टर में सब एंटर होती है। कोरोना के इसके अंदर दिया जाता है, हेल्थ बुलेटिन के अंदर दिया जाता है। दिल्ली शहर के अंदर एक भी डेथ होती है उसको कोई कम या ज़्यादा नहीं कर सकता है।
We next studied data from 4 municipal corporations in Rajasthan. The total deaths in Jaipur, Jodhpur, Bikaner and Udaipur municipal records crossed 23,300 in April and May this year, up from 7,263 deaths in the corresponding period of 2020. But on paper, the COVID death toll remains relatively low, of 2,213 deaths.
मौत जितनी हुई है कोविड से उसको छुपाने में तो किसी को मजा नहीं आता, उल्टा ज्यादा सावधान होंगे लोग अगर सच्चाई सामने आएगी। तो हमारी कोशिश तो यही है कि जितनी कैजुअलिटीज हुई है वो फिगर जनता के सामने रखा जाए।
The spike in fatalities recorded in 2021 compared to previous years is big, is huge, with COVID accounting on paper for a very small percentage of these figures. Authorities should explain the cause of other excess deaths in greater detail. Bureau Report, India Today. All right, viewers, this was the data of 4 states, Delhi being, of course, one of them. But there was also data that we had from the state of Gujarat. Now, that's been highly controversial because there's been a lot that has gone down in print politically, where there have been charges made that the Gujarat government has been hiding COVID death figures. Now, we did not want to put the figures out because the figures which are now out in public domain are the ones that have been put forth by the Congress party because they have done a survey. The government in question has refused to give out data. And it would be highly unfair for us to speculate and put out data because the government needs to give us some data through various data sources. When we did ask the Deputy Chief Minister of Gujarat the question on why the data has not been given out, who's also the Health Minister, Mr. Patel said this to us.
नंबर्स को लेकर बहुत सारी बातें होती है, क्या कहेंगे आप सर कि नंबर्स बहुत ज़्यादा है, सरकार कम दिखा रही है?
बाद में बात करेंगे, सबके साथ बात करेंगे। यानी पद्धति हुई हम ना बधाई मांगे छे।
नंबर्स को लेकर बहुत सारी बातें होती है, क्या कहेंगे आप सर कि नंबर्स बहुत ज़्यादा है, सरकार कम दिखा रही है?
बाद में बात करेंगे, सबके साथ बात करेंगे। यानी पद्धति हुई हम ना बधाई मांगे छे।
All right.